Okay?
Yep.
Okay, Shulman guys, I'm going to tell you about how I explain TMD problems to patients. This is probably my handiest little tool, this Danar simulator. I use an anterior-posterior occlusion jig because that gives the best representation for what TMD problems are. So what I'll do is I'll start off and do a basic examination, show the patient what's going on with their occlusion, and then I'll sit them up and I'll say, okay, what's happening with you as far as jaw problems is really classic. If I've seen this once, I've seen it 1,000 times. Jaw problems are nothing more, nothing less than muscles protecting teeth. In a healthy bite, what you should see is that the teeth fit together when the jaw is seated properly in the socket. But what happens with people who have jaw problems is there's a disconnect between the two. And when the jaw is properly seated, the teeth don't quite fit. Now, if you were to function like that and only hit on a couple of teeth, the teeth would get very sore. So the body tries to protect the teeth, and there's a protective neuromuscular reflex. There's pressure sensors in the membrane around the teeth that send a signal to the brain, which in turn tells the jaw muscles, hey, this is going to hurt. So we want you jaw muscles to guide the jaw so when you open and close, the teeth hit evenly and distribute the forces. Completely subconscious, totally unaware of it. Which is all well and good, and that protects the teeth, but there's a cost. And the cost is, in order to make the teeth fit, you have to dislocate the jaw. And that sets up a whole chain reaction of potential events. First off, it's not resting properly on the disc, so some people get clicking, popping, locking in their jaws. Long term, that can damage the soft tissue in the joints. You can get disc displacements, tears, perforations, that kind of thing. This displacement compresses nerves and blood vessels in the back end of the joint. You get inflammation, sore joints, and guess what? Ear canals right next door. Inflammation in the joint affects the ear. You get fullness in the ears, ringing in the ears, sometimes even dizziness and vestibular problems because of that. Next thing is our headaches. These jaw muscles have to work overtime in order to maintain the bite, and consequently they get tired of doing that. You get headaches. The classic pattern is up in the temples, but what some people will also do is they'll alter their head posture to unload the jaw. Now they're straining neck, upper back, can even affect lower back. That'll show up as a different pattern of headaches, more headaches across the front, whereas the other type are more the headaches around the temporal, but it's basically the same thing. And then there's some people who sometimes don't have a lot of symptoms, but they destroy their teeth because this unstable bite triggers them to do a lot of clenching or grinding of the teeth. They'll wear down the teeth, fracture restorations, cause bone loss, receding gums, wake up with stiff and sore jaws in the morning. So when we're treating problems, basically what we do is we make a splint. And the best way of thinking of it, it's a clear piece of plastic. It fills the space where the teeth don't fit when the jaw's in the right position. And a good way to think of it is that it's an artificial bite. It interposes plastic in between the teeth. Now you break up that neuromuscular reflex and the jaw muscles start to relax. Now the bite changes when that happens, so you have to adjust it. And then it relaxes a little bit more, you adjust, relax a little bit more, you adjust. And I find for people who have significant pain problems, it usually takes at least 6 months. It can take a year to get them to the point where they're stable. In other words, the jaw is not changing anymore and comfortable. And once we get to that point where it's stable and comfortable, then we're going to sit down, reevaluate the bite, figure out, okay, what exactly are the problems here, and then figure out our options for the solution.